As family and friends get ready to gather for the holidays, the CDC is sounding the alarm. Health officials are worried about another COVID surge fueled by both the Delta and Omicron variants. Right now, the Omicron variant is spiking in 39 states and Washington, D.C., with cases doubling every 2 to 3 days. And the CDC now weighing in on vaccines. The health agency recommending Moderna and Pfizer's vaccines over Johnson & Johnson because of the rare but serious risk of blood clots. Although the CDC stresses the benefits outweigh the minimal risk with the J&J vaccine, saying it's better than no vaccine at all. And with another COVID-19 surge expected, this unusual recommendation from the CDC, we have asked Dr. Philip Adams from Deaconess Midtown to better explain, help us understand this a little bit better. First, Dr. Adams, thank you so much for joining us. First off, what are you seeing here in Evansville and the Tri-State? Are we experiencing an increase in COVID cases and hospitalizations here?
Yes, over the last several weeks, we've seen a rise in cases here locally. I think we've about doubled or tripled what we had a few weeks prior to that. So we're definitely seeing that spike.
Are there signs of problems in the coming weeks as well? Do you expect a bigger surge over the winter months?
Absolutely. Historically, after almost every major holiday, we've seen a fairly sizable increase in number of cases that are hospitalized. So we're fully anticipating the same for after this holiday get together.
Now, are the hospitals ready for this surge, or is it similar to how it was earlier in the pandemic, where there's a concern for space in the ICUs or availability of ventilators?
Sure. You know, obviously we're doing our best to keep up with that change in patient volume. I think we're as prepared as we can be for that, but we're certainly feeling the pressures of the additional caseloads, and with the expected spikes, I'm sure it will be a challenge going forward as we've seen that across the country.
Now, Doctor, we've been talking about this for almost 2 years now, and it seems that the message is kind of, people are getting used to it, or they're getting tired of it. I know for a fact it's hard not to. What do you want to say to get people to pay attention this time when we're talking about this?
Sure. We're all really tired of talking about COVID, about seeing COVID, but it's still here. We're still dealing with it. It's still very, very important to get vaccinated. If you have not been vaccinated, to get your booster. If you've not had the booster and you're eligible for it, it's still really important to wear a mask and socially distance. If you have people that are unvaccinated, really doing what we can to reduce the spread as much as possible. We're doing our best as well to fight, the surges that we continue to see. But it is unfortunately still here, and, we hope to keep trying to minimize its impact on everyone.
Why is it so important that we do that? Is it still as serious as it was early on? Are you still seeing people dying from this COVID-19?
Absolutely, yes. We still are seeing, patients dying from this. They're predominantly the unvaccinated patients. That's our, tends to be our most severe cases are those that have been unvaccinated. The vast majority, I think more than 90% of our cases, certainly our fatalities as well, are typically unvaccinated.
Have you seen the Omicron variant here in the Tri-State?
We're starting to see, some changes here and there. It's a little bit harder to diagnose some of these variants. We see some changes in some of the lab tests, but to really get a full picture of it, some of those have to be sent off to the state lab to be identified. So, we're still kind of in that process of picking those pieces up.
How is the Omicron variant really that much different? Are the symptoms any different? I'm hearing that it's a lot more contagious.
Yeah, that's the concern, is that it's a lot more contagious. Right now, as of last week, CDC is noting that it still only makes up about 3% of the total cases, with Delta making up about 97% of those cases. We expect that to certainly change over the coming weeks. There is some concern about the infectivity of it, even with people that have had, a previous dose or two of the vaccine, that they're maybe more susceptible. So I think we're still in the early stages of identifying the effects of Omicron. But I anticipate that that's going to be a much bigger part of the discussion over the next few weeks to months.
Sure, yeah. And you're talking about vaccines. You know, just today, the CDC came out talking about a preference for the Moderna and Pfizer, saying the blood clot risks for J&J make it less preferred. Can you explain that a little bit more, why they've come out to say that?
Sure. So really what they're looking at is the side effect profile. And with the Johnson & Johnson vaccine, it does have a little bit higher risk in terms of blood clots. It's still pretty low, but blood clots can be a significant event for some patients. And so since we're not really seeing that with the Moderna and the Pfizer vaccine, they've added that preference for those vaccines. They've also tended to be a little bit better in terms of protection, in some of the studies. So I think that's kind of also helping to push more favor towards those two vaccines themselves.
All right, Dr. Philip Adams, thank you with Deaconess Midtown, thank you for taking the time. And I know that the Moderna and Pfizer are readily available here in the tri-state for folks that need to get vaccinated. All right.
Thank you.
Thank you, sir.